Rose is 102 years old, and every morning before her feet even touch the floor, she sits on the edge of her bed for 1 full minute just moving her toes. Not because someone told her it was trendy, because 30 years ago her feet started to go numb. Then they started to burn. Then, one winter morning, she stepped on a tack in her kitchen and felt nothing at all. That's the moment neuropathy stops being an inconvenience and starts being dangerous. If your feet ever feel like they're wrapped in wool, if you've ever wondered whether that's really your slipper on your foot or just the memory of one, if your legs buzz at night like a phone on silent that won't stop vibrating, you already know what I'm talking about. You're not alone, and today we're going to fix what we can. Because here's the question that took researchers years to really answer. Is nerve damage in your feet something you just live with, or is there something your body can still do about it? The science says more than you've been told. Let's start with what's actually happening under your skin, because once you understand it, the fear shrinks and the solution gets simple. Rose's grandson, the physical therapist, put it in a way that finally made this click for her. The nerves running down your legs to your feet are the longest in your entire body. Think of them like extension cords stretching from a wall outlet all the way across a house. The farther the cord runs, the more exposed it is to wear, to poor connections, to a kink in the line cutting off the signal. That's peripheral neuropathy. Somewhere along that long cord, the signal gets interrupted from high blood sugar, from certain medications, from vitamin gaps, sometimes from causes doctors never fully pin down. Rose spent years not knowing which one applied to her. But here's what surprised the scientists who study this. Nerves are not just cords. They're living tissue, wrapped in tiny blood vessels that feed them oxygen. The same way a garden hose feeds a row of plants along a fence. Cut the flow even partway, and the plants at the very end of the row farthest from the tap are always the first to wilt. That's exactly why neuropathy shows up in your feet before it ever touches your hands. Your feet are the end of the row, and blood flow, the thing that feeds those nerves, responds to something you have direct control over. Movement, the same thing Rose leans on every single morning. Rose didn't know the biology at first. She just noticed that on days she walked to her mailbox and back, her feet felt less like static and more like feet. It took her grandson, a physical therapist, to explain why, and once he did, she never skipped a morning again. Now I want to be honest with you, because this channel doesn't do false hope. Exercise does not reverse nerve damage that has already scarred over. If a nerve fiber has died, movement will not resurrect it. That's the sober truth. But most people with neuropathy still have living nerve fibers that are simply undernourished, understimulated, and out of practice sending signals. And for those fibers, the ones still alive but struggling, the research on exercise is honestly remarkable. There's a reversibility switch here, and most people never find out it exists. Rose used to think her numb feet were simply a family curse. Her mother had it too, in her final years. Turns out that's only part of the story. So let's talk about why your feet ended up here in the first place, because there isn't one single cause. There are 4 main drivers, and knowing which one applies to you changes almost nothing about the exercises, but everything about your peace of mind. Driver 1. Blood sugar. High glucose over years can quietly damage the small blood vessels feeding your nerves, the same way sediment slowly narrows a pipe. This is the most common driver after age 60, and it's rarely sudden. It builds for years before your feet ever say a word about it. Driver 2. Certain medications, including some chemotherapy drugs, which can affect nerve fibers as a side effect of treatment that may have saved your life. If this is your cause, please don't ever stop or change a medication without your doctor. The goal here is supporting your nerves, never interfering with your treatment. Rose's own neuropathy, it turns out, came from a mix of driver 1 and driver 3, which is the one almost nobody mentions. So let's pause here for a second, because this is the one that surprised me most when I first read the research. Sitting, not smoking, not diet, not genetics. Prolonged sitting quietly starves the exact blood vessels your feet depend on. Every hour in a chair is an hour those vessels get a little lazier. Researchers studying older adults with diabetic neuropathy found that simply adding structured movement, nothing extreme, just consistent moderate movement, measurably improved nerve signal speed within weeks, not months. Weeks. That single finding is the reason a woman who's outlived 3 presidents still does 12 minutes on her bedroom floor every single morning. Driver 4. Vitamin B12 gaps, more common in adults over 70, especially those on certain long-term medications like metformin or acid reducers. This one is worth mentioning to your doctor directly, since it's often a simple blood test away from an answer, and correcting a deficiency can meaningfully ease symptoms on its own. 4 different roads. 1 shared exit ramp, movement, done the right way, done consistently. And Rose is proof that the exit ramp works at any age. She started this routine in her 70s, and she's still walking it, literally, past 100. Now here's the study that genuinely surprised the people running it. Stay with me on this one because it's the whole reason this video exists. A team working with older adults who had diabetic nerve damage put one group through structured resistance training, nothing heavy, no gym equipment, just controlled repeated movements against light resistance, 3 times a week for 12 weeks. The other group changed nothing about their routine. The researchers expected pain relief, maybe better balance, reasonable, modest expectations. What they didn't expect was that nerve conduction velocity, literally, the speed at which a nerve signal travels from your foot to your brain and back, actually improved in the exercise group. The signal got faster, in a nerve that had been damaged for years, in people in their 70s and 80s. After 12 weeks of simple, unglamorous movement done from a chair, Rose is well past the age range of that study, and her own grandson still checks her balance and reflexes every few months just to track her progress, proof that the same thing that worked for people in their 70s keeps working decades later. Separately, in patients dealing with nerve damage from chemotherapy, researchers found that a structured hand and foot exercise routine reduced tingling, numbness, and pain within days. But the detail that matters most came 2 weeks later. The group that kept doing the exercises held on to those improvements, while the group that stopped slid right back to where they started. The exercise wasn't a one-time fix. It was upkeep, like brushing your teeth or watering a plant. That's the part I want you to sit with. This isn't a pill you take once. It's a signal you send to your body over and over until your nervous system starts trusting that the signal is worth carrying all the way down to your toes. Rose sends that signal every single morning, rain or shine, birthday or not. 6 exercises, 12 minutes. That's the whole routine. No equipment budget, no waiting room, no appointment needed. Let's walk through them together. Exercise 1. Ankle pump. Sit in a sturdy chair, feet flat. Point your toes forward, then pull them back toward you like you're gently pressing a gas pedal and releasing it. 10 to 15 slow pumps, each foot. This is your warm-up. It wakes up circulation before you ask your feet to do anything harder. Exercise 2, toe curls. Place a small towel flat on the floor under your foot. Scrunch your toes to gather the towel toward you, then release. 10 reps per foot. This rebuilds the small muscles in your feet that neuropathy quietly weakens, the ones responsible for your sense of the ground under you. Exercise 3, seated marching. Still in your chair, lift one knee, then the other like a slow march in place. 30 seconds on, rest, repeat twice. This is the aerobic piece, the one tied to that nerve conduction study. It's gentle enough for 90-year-old joints and strong enough to matter. Rose does hers to the radio, usually something from the 40s, because she says a little rhythm makes the minutes disappear. This is the halfway point of the routine, and if your feet already feel a little warmer or a little more awake, that's not your imagination, that's blood finding its way back to where it's needed. Exercise 4, heel to toe rocks. Standing behind a sturdy chair for support, rock your weight from your heels to your toes and back, slow and controlled. 10 rocks. If standing balance is shaky for you today, you can do a gentler version seated, simply pressing your heels down and then your toes down, alternating. This retrains the pressure sensors in your feet that neuropathy dulls first, the same sensors that tell you where the floor is without needing to look down. This next one is Rose's least favorite and the one her therapist insists she never skip. Exercise 5, single leg balance. Holding the chair with both hands, lift 1 foot 2 inches off the floor for a count of 10. Switch feet. If 10 seconds feels like a lot today, 5 is a perfectly good place to start. This is the one researchers found cut fall risk significantly in people with neuropathy, because balance, more than almost anything else, is what protects an independent life after 80. Exercise 6, resistance band ankle presses. Rose's favorite, oddly enough, because she can do it in front of the television. Loop a light resistance band, even an old stocking, works around the ball of your foot, holding the ends in your hands while seated. Gently press your foot forward against the resistance, then slowly release. 10 reps, each foot. This is the exercise most closely linked to that faster nerve signal we talked about. Light resistance, repeated consistently, is doing more for those nerves than most people realize. 12 minutes. No equipment beyond a chair and a towel. No gym membership. No pill. And notice nothing on this list requires you to be able to get down on the floor, or hold a plank, or do anything a 90 or 100-year-old body isn't built for anymore. That's not an accident. It's the whole point. Rose does this before her coffee, before the news, before anything else demands her attention, because she learned the hard way that the morning she skips it is the morning her feet remind her why she started. I want to say something plainly before we close, because this matters more than any single exercise, and it's the same thing Rose's own doctor tells her every year at her checkup. If you're noticing numbness that's new, or a wound on your foot you can't feel, or your neuropathy is getting worse quickly, please see your doctor. These exercises are something you add to good medical care, never something that replaces it. But if you've been sitting with numb, burning, buzzing feet, quietly assuming this is just what getting older feels like, I want you to hear this clearly. For a lot of people, it isn't the finish line. It's a signal your nerves are asking for, and you're one 12-minute routine away from starting to answer it. The same routine Rose has never abandoned. Here's what I want you to remember. Movement feeds the blood vessels your nerves depend on. 6 specific exercises: ankle pumps, toe curls, seated marching, heel-to-toe rocks, single leg balance, and resistance band presses target exactly what neuropathy takes from you. And consistency, not intensity, is what turns a nerve signal from a whisper back into a clear message. You don't need to do all 6 perfectly on day 1. Pick 2. Do them tomorrow morning before your coffee. Add a third next week. This isn't a test you can fail. It's a habit you're allowed to build slowly, the same way Rose did, one ordinary morning at a time. Picture your own kitchen floor, the cool tile in summer or the warmth of a rug in winter. That feeling under your own 2 feet, fully felt. That's not a fantasy for people your age. For a lot of you, it's 12 minutes away from becoming real again. Rose is 102. She still feels her kitchen floor under her feet every morning. Not because she was lucky. Because she showed up for 12 minutes, most days for 30 years. If this helped you understand your own feet a little better, stay close. Because there's something else quietly driving nerve damage in people over 60. That almost nobody talks about. And it's not what you'd expect. We're going to open that up next. Take care of those feet. I'll see you there.